In today's video, I'm going to hit you up with the next big buzzword in goalie training, bigger than puck tracking and active hands. It's neutral pelvis. I bet probably 20% of you have heard the term already. I bet you most of you weren't exactly sure what it meant when you heard it. I bet you most of the people saying it to you weren't exactly sure what they even meant. So in today's video, I'm going to explain exactly what it is, why it's important, and how you can train it. It's not really about your balance on the ice, but it is about your biomechanics. So let's do this. Let's head down to the lab and I'll walk you through it all. So by the end of this video, you're going to understand neutral pelvis. Yeah, it makes sense, but then did you look at his pelvis? Like, does he have neutral pelvis? There's your problem right there. No, seriously. It was probably like the most neutral pelvis I've ever seen. I'm just my feet. Give me a second. So then I just did a little work on neutral pelvis and bada boom. Kid's moving like Carey Price. Uh-oh. Forgot to clean out my synthetic ice last night after the skate, so I'm gonna do that first. Then we'll talk all about neutral pelvis. 1 second. Talking about what it is, and I've enlisted my trusty little spine and pelvis model. So as you can see, the pelvis isn't just one solid bone. It has some joints that are sort of where bones are fused together with a cartilaginous attachment or a fibrous attachment. So it's not one solid bone. So you can see here's one. This is your sacrum. So, and this is your ilium. So this is the one sacroiliac joint. This is the other sacroiliac joint. And then here you have your pubic symphysis in the front there. So the pelvis is really three bones fused together. Two ilium, do you call them ilia? I'm not sure. And your sacrum. So there is actually there can be a little bit of movement. That's a story for another day. But today what we're talking about is neutral pelvis. So if we look at these landmarks, so these bumps on the front of your hip bone, you can feel those on yourself. When you dig in here, you know, that's sort of the bony prominence you're feeling. This is called your ASIS, your anterior superior iliac spine. Back here would be your PSIS, posterior superior iliac spine. So when we are in a neutral pelvis, basically our ASIS and our pubic symphysis are sort of on the same plane. So let me see. I'm gonna unscrew this thing. It's tenacious. I'm glad we aren't put together like that. That's uncomfortable. So let me be very clear. This is your front. So your pubic symphysis is at the front. Your sacrum is at the back. This is your little tailbone. So this is my front. This is my back. So if I am tilting my pelvis this way, that's an anterior pelvic tilt. If I'm tilting my pelvis, it's a little hard to show. I'll show you on myself. If I'm tilting my pelvis this way, that's a posterior pelvic tilt. What we want is to sort of be in that neutral position. So let me show you on me, and I'll kind of exaggerate what it looks like so that you can get a really good sense of, hey, what's an anterior pelvic tilt? What's a posterior pelvic tilt? Where's neutral? Then we'll talk about why it's important. So when I'm in this position, this is fairly neutral. So you're neutral if you have a slight arch in your lumbar spine. That is normal. Our spine is designed sort of in a shaped curve. So that is normal to be a little bit extended in your lumbar spine. So this is neutral pelvis. This is an anterior pelvic tilt. This, tucking under, is a posterior pelvic tilt. Another way that you can find neutral pelvis, and this is the way we kind of teach it, is if you lie down on your back. So if you lie down on your back and you find your ASIS on both sides and your pubic symphysis, which is that bony prominence in the middle, and if you kind of put your fingers on it or lay your hands on it, you want to get it so that those are on one plane, so that they're aligned with one another and they're flat. As if your pelvis was like a bowl and you'd have that bowl perfectly level. You wouldn't be spilling out in an anterior tilt or spilling towards you with the posterior tilt. So you just find those landmarks and you look, because sometimes what you feel isn't right until they're sort of in that neutral position or that flat position. And that is your neutral spine. So you can see I do have a slight arch in my low back, but it's not, you know, it's not enough that I could even stick my hand under there. It's just my fingertips. And it'll be different for all of us. So we'll have slight variations, but that's how you can find it. Okay, now let's talk about why is it important. So now that you know more about neutral pelvis than probably even most NHL goalies, now would be a great time to hit the like button while you think about, ooh, do I want to hit the like button? Don't I want to hit the like button? I'm going to go out and practice my skateboarding a little bit, because it's been quite a while since I've been on it for some reason. I don't know, I just got out of the routine and I was more than a little shaky on it today. I'm a little disappointed actually. So I'm going to go rip around a little bit. You hit that like button or don't, and then I'm going to come back and explain why it's so important. So here's why neutral pelvis is important. And if you've ever been a pitcher or had a shoulder injury, what's the first thing that you work on, or the physical therapist or the strength coach works on to help get your shoulder functioning better? They work on your scapular positioning, right? Because your scapula, so your shoulder blade, it actually integrates the socket of the ball and socket joint of the shoulder. So if your shoulder blade isn't sitting in a good neutral position, if your shoulder blade's dumped forward, that changes the orientation of the socket, and then your shoulder can't move the way it's supposed to move. Let's do an experiment. If you are a recurring dislocator, please don't do this experiment, because you might dislocate your shoulder. So you just watch, but everyone else can try it. So if we kind of artificially slump our shoulders forward, and then we try to trace as big a circle as we can with our shoulder from that slump, that's about as far as I can get. Now I have to come out to the side to get around it, and then I can kind of move again, okay. So it automatically limits our range of motion, and it doesn't feel very nice on my shoulder either. It doesn't feel painful, but you can tell it's sort of grunting around in there. Now I'm going to get my nice scapular position, give a little squeeze, keep my shoulders back, and now I can get full range of motion, and it feels much better. This is the same for your hips. So let's look at what happens to your hip range of motion when you anteriorly pelvic tilt, which is what most people do. You don't see too many people who go around with a posterior tilted pelvis, especially not hockey players. You know, hockey players that have that big butt, and you think like, oh, that's a hockey player butt. Wow, they're really strong in their glutes. Really what they have is probably tight hip flexors, which are pulling them into an anterior pelvic tilt so that their butt sticks out in the back, kind of like Kim Kardashian does. That's not, yeah, whole other topic. But so let's artificially go into an anterior pelvic tilt. You can play along at home. And then we're going to bring our hip into as much flexion as we can. So we're going to bring our knee up towards our chest as high as we can, keeping this, you know, sort of fake anterior pelvic tilt. Ready? Here we go. That's it. So I can't even get my thigh parallel to the floor because I've tilted the position of my acetabulum, of the socket of my hip joint. And so now my thigh bone is sort of smashing into the front of my hip joint. There's nowhere for it to go. It's stuck. Let's come now into neutral pelvis. So if I have my ASIS, my pubic symphysis, I kind of get those in a neutral plane, and now I'm going to bring my knee up as high as I can. So I can get that knee as high as my belly button, and it feels a lot better. If you're a skater, you can get away with this a little bit because your normal range of motion, you know, you're not bringing your knees way up here when you skate. If you're a goalie, however, when we're in the butterfly position and we need to recover, this creates a problem. Let me show you. So now I'm in my butterfly position and I want to recover this leg to push back to my post. If I'm in an anterior pelvic tilt, again, I'll do it sort of artificially, but a lot of you are in this position all the time, partly because you sit all the time, then you play goalie all the time. Your hips are chronically flexed, and so the tissues shorten to accommodate that, and it kind of pulls you into this anterior pelvic tilt position. So if I want to go recover this leg, push back to my post, well, let's see, I'm anteriorly pelvic tilted. That's about how high I can get my knee to come up. So what do I have to do? Well, I have to compensate in some way. I might not be able to get all of my blade on the ground. I might have to lean away a bit, which is what you see, even you coaches, you see your goalies, when they come up, they lean away a bit because they have to make room to get their blade on the ice. It's not a balance issue. There's no space for them to move, so they have to move effectively. They have to move their whole pelvis to get that range of motion. Let's come into a neutral pelvis and see what that looks like. So now I'm neutral. I'm going to recover this leg to push. Boom. I've got all the space that I need to get that push. So two reasons it's important. Number one is it lets you be more loose in your hips, to have more range of motion where you can, pick the angle and the magnitude of the push you want to take. That's key. The other thing that you might not realize is that when I'm anteriorly pelvic tilted and I'm trying to recover and I can't do it, I'm rubbing my femur, the ball of the ball and socket joint, into the socket. That's one of the things, that's what's limiting me in the range of motion. And as I rub over time, it's the same thing as when you start shoveling in the garden. It's not like painful right away, but over time you can develop calluses, or you're putting overload on that area, and the body's natural response is to lay down more of that material. So on our hands it's skin, in our joints it's bone. So as we're constantly putting a little bit more wear and tear in that area, your body's like, whoa, wow, this area really needs to be stronger. We need to beef it up, and it's going to lay down more bone, which over time decreases the space in the joint, which over time leads to a femoroacetabular impingement syndrome, FAI, which is another whole ball of wax. So we're not going to chat about that today, but this is why neutral pelvis is so important. So it doesn't really have to do with balance per se, although if you are anteriorly pelvic tilted and you have nowhere to go, then you're going to naturally compensate by leaning away, which will put you out of balance. Now I want to show you something. This is where it gets a little tricky. Any excuse to put on the gear. I can't remember if I tuck or don't tuck anymore. That's how long it's been. Pretty sure I tuck. Yeah, I tuck. Okay, am I in neutral pelvis now? How about now? How about now? Now? Have I got it? Is this right? Maybe if you have an incredible eye, I'm not sure how, unless it's so, unless it's so dramatic, that, but even this isn't not neutral pelvis. It's you're sitting back in your hips. You're not staying up tall. So if I'm tall in my hips, like, see if you see any difference. I'm in as anterior pelvic tilt as I can muster right now. Now I'm neutral. Now I'm as posterior as I can get. Do you see any difference? And I don't even have a jersey on. So it's very hard for your goalie coach or anyone to see you on the ice and be like, aha, you need to fix, you're not in neutral pelvis, you need to fix this. But we can do some things away from the ice to help practice, because neutral pelvis is posture. Posture is very, very hard to change. You have to be deliberate about it, and you have to be consistent about it, and you have to think about it throughout the day. It's not something you can just work on for 10 minutes a day and you're going to get it, because our body just knows and just adapts to whatever we tell it to do the most. So let me give you a few ways that you can work on it, and then it's up to you to do the rest. If you want to play with neutral pelvis on the ice, then you have to basically learn to go about your activities of daily living with neutral pelvis, which isn't a big deal. It's going to take wear and tear off your back. It's going to help you just do all of your activities of daily living more efficiently. So let me give you, it's hot. I'm going to take this gear off and give you a couple tips. So the number one thing you're gonna do, and it will sound maybe a little like, that's it, like that's all, is just throughout your day, you're gonna find neutral pelvis. You'll put your hands on yourself, not in front of people who are gonna call the cops or anything, but you'll find neutral pelvis. You'll make a little mental snapshot of what that feels like. For most of you, it's gonna feel like you're tucking your bum underneath. One should also think about using your abdominals, your rectus abdominis, to sort of hold that. So almost like you're doing a mini reverse crunch, not to overcorrect, but just to hold that position. I want you to try not to squeeze your bum cheeks to hold that position. So then, while you're sitting at your desk, you're thinking about neutral pelvis. You're not, sitting back on your tailbone. You're sitting on your sit bones in neutral pelvis with your abdominals helping you keep that. Then when you're walking around, going for a walk, doing the grocery shopping, mowing the grass, whatever it is, you're gonna go back to that snapshot of neutral pelvis, and then you're gonna get back in that position. My posture was a big thing I worked on in university because my sports injury prof, Professor Lipinski, said that you couldn't change, that posture is too hard to change to not even bother. So I kind of took it as a challenge. So what I did was every time I changed classes and was walking somewhere different on campus, I would pay attention to my posture. And it improved over time. And really, I need to work on it again because I think it slipped a little bit. But when I worked at the sport medicine clinic, people would ask, like, did you serve in the military? Because my posture was so, upright. So it's the exact same thing. So anytime you're on your phone, stand up, get in neutral pelvis. That's the way you need to learn it first. You need to become consciously competent. Then once you're sort of so consciously competent, if I think about it, I can get the right position. You'll make that snapshot, and then you'll be able to get in that position without even putting your hands on yourself in an embarrassing way. And then when you become subconsciously competent, then you can start adding it into your training. And not to get like obsessive about it, like, oh, I'm squatting, is my pelvis neutral? Don't obsess over it. But when you're doing your agility training, okay, am I in that neutral pelvis? And even, so maybe I'm here and I'm doing quick step, 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 stick. And then just think like, yeah, am I in neutral pelvis? Step, step, stick. Am I neutral, or do I fall back into my anterior pelvic tilt? Neutral pelvis does not mean straight up and down. So I can be in neutral pelvis here. I can be in neutral pelvis here. I'm hinging at my hips. I'm not changing my pelvis position. I'm not flexing or extending my lumbar spine to change position. So that's really the key. Practicing it in activities of daily living. Practicing it when you're doing your goalie specific agility work, I think, is the best. If you're using a slide board on synthetic ice, taking the time to think about it. How does it feel? Then take it out onto the ice when you're doing your warm-up. Try to practice that. It'll get to be more familiar, and over time, and it'll take a long time. It's not like a 2-week thing. It's going to be like 6 months. You're going to start noticing, yeah, now it actually feels more natural. That's what it takes to change it. But again, you're going to move so much more efficiently, and you're going to reduce wear and tear on your hip joints. The thing about FAI is it feels fine until it's a pretty big problem. So it's developing just by you adding wear and tear to your hips without you realizing it, until it's like, wow, how come now I'm losing range of motion and I'm getting pain in my hip? So it's definitely worth the investment of your time and your concentration. For me, this whole thing about neutral pelvis started probably 3 years ago or so, when I started working with an equestrian athlete, and she was explaining to me how the rider's pelvis and the horse's pelvis kind of integrated, and they use their pelvis to communicate. The rider used their pelvis to communicate to the horse. I always thought they just squeezed with their knees and pulled with their hands, but apparently no, that's not how you do it. So that automatically made me think of Carey Price, obviously. But, you know, he's probably one of the smoothest goalies out there. It looks effortless. His body always looks quite quiet. It's probably what I most, as a physiologist and biomechanics geek, it's like, that's what attracts me to Carey so much. I just love watching him move. And so right away I thought, aha, because Carey used to ride some rodeo, and he's familiar with being on a horse and all that. So I thought, I wonder if this is part of it, that he really has good, awareness of his pelvic position, and if that helps him. I did ask him about it, and he was like, I don't know. So, but that's what sort of got me into thinking about the hip position and impingement, and even, keeping your center of mass balance where you don't have to lean away to get the space you need to get a good bite with your skate as you drive. You can see it's very hard for your coach or anyone to see it on the ice. So I think off ice is a great place to work on it. I've actually gone so far as I've ordered some 3D motion analysis sensors, so that I can play around with it and hopefully come up with definitely come up with some new exercises to really help you, and ways to help you practice it off the ice. So yeah, like I said, I'm total geek at heart. So I'm waiting for those to come. They're like pre-ordered, so I'm pretty excited about that. So stay tuned to see some shenanigans with those. So there you go. There is everything you need to know about neutral pelvis. So now you can go out and start throwing around like, oh yeah, I was doing some puck tracking with neutral pelvis and active hands, and everyone will think, oh my gosh, this person's so smart. Before you do that, make sure you hit the like button. While you're at it, you may as well hit the subscribe button, because I'll see you next Wednesday with another brand new video that's going to help you win more games with fewer injuries. Before I leave too, I'll let you know that this video is sponsored by my personal piggy bank, and if you just can't wait or till next week and you want to work on something and you haven't done the butterfly challenge yet, click on the link in the description, or let your fingers do the walking over to the app store, your app store, whatever it is, and type in butterfly challenge. It's a free 14-day goalie specific mobility program that gives you a wider butterfly flare, and it actually really, really works. So that's it. I will see you next Wednesday. Have a great one. Whoosh. Oh, and if you have any questions, just leave them in the comments below. I answer each and every one of them personally, unless you say something mean, in which case I cry a little bit, although I try to stifle it, and then I run to Paul and I try to get Paul to beat you up, which he refuses to do. So then I just go in my room and pout for a little while until I'm over it. But otherwise, I'll reply to each and every one. See ya.